Hello everyone, and welcome to Complete Nursing Solutions. In today's video, we'll be diving into a quiz on beta blockers. Whether you're a nursing student, healthcare professional, or just looking to refresh your knowledge, this quiz will help test your understanding of beta blockers, covering their uses, mechanisms of action, and potential side effects. Beta blockers play a crucial role in managing a variety of cardiovascular conditions, including hypertension, heart failure, and arrhythmias. It's important to understand not only how they work, but also their potential side effects and contraindications to ensure safe and effective use. Always be mindful of any adverse reactions, especially in patients with pre-existing respiratory conditions like asthma or COPD. So, let's get started.
What is the primary mechanism of action of beta blockers? Option A, inhibition of calcium channels. Option B, blocking alpha-adrenergic receptors. Option C, blocking beta-adrenergic receptors. Option D, increasing blood vessel dilation. Answer. Option C, blocking beta-adrenergic receptors. Beta blockers work by blocking beta-adrenergic receptors, specifically the beta-1 receptors in the heart, and beta-2 receptors in the lungs and blood vessels for non-selective beta blockers. This leads to a reduction in heart rate, force of contraction, and overall cardiac output, which lowers blood pressure and reduces the heart's oxygen demand.
Which of the following is a common use for beta blockers? Option A, treating bacterial infections. Option B, managing high blood pressure. Option C, increasing blood sugar levels. Option D, reducing cholesterol levels. Answer. Option B, managing high blood pressure. Explanation. Beta blockers are commonly used to treat conditions such as hypertension, arrhythmias, heart failure, and angina. They work by decreasing heart rate and reducing the force of contraction, which lowers blood pressure.
Beta blockers are typically contraindicated in which of the following conditions? Option A, asthma. Option B, hypertension. Option C, hyperthyroidism. Option D, migraine. Answer. Option A, asthma. Explanation. Beta blockers, especially non-selective ones like propranolol, can exacerbate respiratory symptoms in patients with asthma by causing bronchoconstriction. Selective beta-1 blockers, like atenolol, have a lower risk, but caution is still needed in asthmatic patients.
Which of the following is an example of a non-selective beta blocker? Option A, atenolol. Option B, metoprolol. Option C, propranolol. Option D, bisoprolol. Answer. Option C, propranolol. Explanation. Non-selective beta blockers like propranolol block both beta-1 and beta-2 adrenergic receptors, which can affect the heart and the lungs. Selective beta-1 blockers like atenolol, metoprolol, and bisoprolol primarily affect the heart, with fewer effects on the lungs and blood vessels.
What is the primary side effect concern when using beta blockers in patients with asthma? Option A, bradycardia. Option B, bronchoconstriction. Option C, hypertension. Option D, insomnia. Answer. Option B, bronchoconstriction. Explanation. In asthma patients, non-selective beta blockers, which block both beta-1 and beta-2 receptors, can cause bronchoconstriction by blocking beta-2 receptors in the lungs, leading to difficulty breathing and potential asthma attacks.
Which type of beta receptors do beta blockers primarily target? Option A, beta-1 receptors, cardiac. Option B, beta-2 receptors, vascular. Option C, both beta-1 and beta-2 receptors. Option D, alpha receptors. Answer. Option A, beta-1 receptors, cardiac. Explanation. Beta-1 receptors are primarily found in the heart. When blocked, they reduce heart rate and myocardial contractility, which helps to lower blood pressure and reduce cardiac workload. Some beta blockers are selective for beta-1 receptors, example, metoprolol, while others are non-selective and affect both beta-1 and beta-2 receptors, example, propranolol.
Which of the following is a common side effect of beta blockers? Option A, weight loss. Option B, dizziness. Option C, hyperglycemia. Option D, increased heart rate. Answer. Option B, dizziness. Explanation. Beta blockers can cause dizziness or lightheadedness, especially when standing up quickly, orthostatic hypotension. Other side effects can include bradycardia, slow heart rate, fatigue, and depression. Hyperglycemia is less common, but beta blockers can mask symptoms of hypoglycemia in diabetics.
What is the preferred beta blocker for a patient with a history of chronic obstructive pulmonary disease? Option A, propranolol. Option B, atenolol. Option C, metoprolol. Option D, carvedilol. Answer. Option C, metoprolol. Explanation. In patients with COPD, it's important to use a cardioselective beta blocker like metoprolol or atenolol, which primarily block beta-1 receptors in the
Which of the following is a key difference between selective and non-selective beta blockers? Option A. Selective beta blockers affect both beta-1 and beta-2 receptors. Option B. Non-selective beta blockers primarily block beta-1 receptors in the heart. Option C. Selective beta blockers target only beta-1 receptors. Option D. Non-selective beta blockers are only used for hypertension. Answer. Option C. Selective beta blockers target only beta-1 receptors. Explanation. Selective beta blockers, example, atenolol, metoprolol, mainly target beta-1 receptors in the heart, leading to decreased heart rate and lower blood pressure. Non-selective beta blockers, example, propranolol, block both beta-1 and beta-2 receptors, affecting the heart as well as other systems such as the lungs and blood vessels.
What is the most serious potential consequence of abruptly stopping beta blocker treatment? Option A. Respiratory failure. Option B. Rebound hypertension or tachycardia. Option C. Severe dizziness. Option D. Kidney failure. Answer. Option B. Rebound hypertension or tachycardia. Explanation. Abruptly discontinuing beta blockers can lead to rebound hypertension or tachycardia, an increase in heart rate. This happens because the body becomes dependent on the beta blocker to control heart rate and blood pressure. Stopping suddenly can cause an overreaction of the sympathetic nervous system, resulting in a rapid increase in blood pressure and heart rate.
Don't forget to like, share, and subscribe to our channel for more helpful content. Stay tuned for more nursing tips and educational videos.